Okay, well, that's our cue to get started. So again, welcome to our IDRPP's Time to Act Mental Health Echo. We're glad that you joined us today. If you could take a minute and put your name and contact information into the chat. Like I said, it's just a way for us to know who's on the call and get to know each other in this virtual world. We are recording today's session. It is always stored on our Canvas page as well as our YouTube channels. We use those for educational purposes. You are always free to go back and review that information, share it with colleagues. You know, sometimes we're talking about things that take a couple of times to hear and listen to really digest it all. Echo is an interactive community, so please put your thoughts, comments, questions into chat. Kurt Phillips, who is one of our hub members, will monitor that chat for us and make sure that your questions are being answered and shared. We love case narratives. Case narratives are a great way to learn more, share information with all of these amazing colleagues on the call. So if you are ever interested in presenting a case, whether it's just you want more discussion about a case that you're working on or are struggling or want to celebrate with us, please consider submitting a case. Like I mentioned, we do talk about sensitive topics, and sometimes the families that we're working with are, we want to make sure that we just protect their privacy. So avoid using any identifiable information. Key components of an echo, if you've never attended one, is we always have a presenter or a speaker coming and talking to us about a specific topic. We then go over a case presentation and small breakout groups where we then discuss the case presentation. That is such a wonderful way to learn from all these amazing colleagues on the call, to know that I know nobody likes it when I can see their name and pictures. So Megan, I'm calling on you because you are probably going to share something really great in that case presentation. And I want to know, can I reach out to you? If we were in person, I would be able to do that connection and networking. So hopefully trying to do that same professional networking on the call. We've all been on Zoom, so I'm not going to spend a lot of time on renaming or raising your hand. If you have any questions about that, please reach out to myself or any of our hub members. They all have, or will now have, since I'm doing the reminder, an asterisk in front of their names, so they are easier to find on the chat call. In order to get a certificate of attendance, we do ask that you complete the survey. The survey will be dropped in throughout today in the chat. And after you complete the survey is when we send out that certificate of attendance. And thank you all to everybody who always fills out those surveys. It really does give us valuable information that we then take back to our hub team and make any changes. Your recommendations on topics are what we then look for our future networks. Canvas is where we store everything. If you would like access to our Canvas page, please email us at timetotAct@aggies.usu.edu, and we will get you access to our Canvas page. Again, just another plug for case studies. We're always looking for those. I know sometimes that's not the easiest thing to do is talk about a case. But if you have a case that you would like to have discussed, please reach out to us. I'll be more than happy to share your case and talk about it. You get such an amazing list of recommendations and resources. We were doing our year-end report just in December. And this group, you guys have given over 800 new resources to the people that are submitting cases for us to all go back and look at and utilize those with families or the clients we work with. So you guys are just amazing on this call. We do have a Facebook group that we would hope to establish to continue connections and conversations on what we're being discussed on this call. So you could take a minute and join that. Again, we also have different social media. And I'm thrilled today to stop talking and turn the time over to Family Place, who is going to be talking to us about ongoing trauma. So Brittany, I've lost you amongst my people and Sarah and Analee. So start talking so I can find you.
I'm here. You're good. Okay. Can you guys see the slides?
Yes.
Perfect. Okay. So we'll get going. So we're super grateful to be here. There's 3 of us presenting, and we'll just kind of jump right in. So our goals for the presentation today is I'll do some introductions of those of us that will be presenting. Then we'll talk about a little bit about the Family Place. We'll do an overview of ongoing trauma. Then we'll go into the impacts on individuals experiencing that ongoing trauma. We'll talk about some interventions used for ongoing trauma, specifically that we use at the Family Place. And a lot of this will be able to be applicable in any realm. But I will say we have 2 amazing therapists on with us today presenting. And so they do a lot of mental health. They are also mothers and community members that are always trying to better the community. And so you'll find a lot of awesome tips and tricks of ongoing trauma from them, not just in a mental health clinical way. We'll also have our impacts on the helpers, and then we'll go into any conclusions or questions before we turn the time back over. So that's kind of our goals for today. Like I said, or like was already said, my name is Brittany Bird. I have worked at the Family Place for about 11 years. I'm focused on building the strengths of clients and supervising our therapy team support staff, as well as our victim advocate. And when asked to present, I felt a little bit out of my realm. And so I brought in 2 of our clinical supervisors, Sarah Heiner and Analee Pacheco, to be able to work with us. And so Sarah is a CMHC, Analee is an LCSW. Sarah has worked with children and their parents, as well as trauma victims, in a very strengthening way. She uses all of those different modalities there. And mostly Sarah is just a calming presence, and it's what we really are grateful for her at the Family Place. We also have Analee, like we said. She started her career in social work at DCFS, and has continued to protect children by working with families in therapy. Both of them, like I said, are training future therapists as well as taking on their own clients. They both use very similar modalities, and Analee is the heart of our therapy team at the Family Place. She is definitely one of those people that you get to know, and she just brings a smile to your face because she's happy and positive and always ready to lend a hand, obviously, since they're both here helping me today. So that is us. We wanted to do just a quick kind of rundown of the Family Place so that you can understand a little bit about where we're coming from, as well as what we do at the Family Place, so that if you want to refer anybody to us, we'd love to help any of your clients, or if your family needs help, we'd love that as well. So the Family Place is split basically into 3 kind of main departments. Our first is our Kids Place. Our Kids Place is a childcare facility meant to strengthen families and protect children. The way that we do that is we are the shelter for cash and rich counties. And so when a child's removed from their home for abuse or neglect, they can come and live with us until they're placed into foster care. So we're kind of that transition home between removal and placing with a foster family. Kids can stay with us any range of time that DCFS grants as something that is necessary. So we really just become that home-like atmosphere, trying to provide those kids some stability in that time. We also offer crisis care. Crisis care in the Kids Place is for anyone in the community that's needing help. It can be an emergency similar to a car accident. Parents need to go to the hospital, and they don't want their kids to have to go. The kids can come and stay with us, as well as we offer scheduled weekly care. We've changed the name of it a few times. Sorry for that. So scheduled weekly care, that gives a family 2 hours a week to be able to bring their kids in. While the kids are with us, the parents can do anything they need to better their family and better their family's experience. And so they can do doctor's appointments, court appointments. We have parents that use it for their weekly grocery shopping, as well as just taking a nap, right? Sometimes parents just need time to themselves. So that's 2 hours a week that any family in Cache and Rich County, as well as we do serve up into Idaho as well, to be able to, just the beginning of Idaho, Preston kind of area, to be able to take a break. The coolest thing about the kids' place is it's also a therapeutic childcare, and so they're learning social emotional skills while they're with us. The next department is our family education department. We have so many services in our family education. If there's something you'd want to learn, we have somebody that teaches it. We do focus a lot on our step family class. That's any family that is going into a step or separated experience. They can come into that class. We also have parenting classes, date night classes to be able to kind of help build connections amongst parents. We teach every time parents come in. We also offer childcare that's also learning and growing those same skills. We in education is as well as our it just went out of my mind. Yes, we do home visiting. And so our home visiting program goes into homes, teaches about trauma, and helps families that have experienced traumatic events. So that's kind of our education. There's lots of different things in there. We also are the main provider of body safety in the school system in Cache and Rich counties. So we go into the schools and teach about body safety as well. And then our last department is therapy. So we in therapy serve anyone from 0 up to whenever. We in the last year have started, well, I guess 2024 now, we started doing CPP, which is child parent psychotherapy. Gives the parents and children that have experienced a traumatic event an opportunity to build those, and that can be 5 and under. And so we're one of the only places that can serve very littles in our therapy experience. We have therapists that range in all different fields, all different modalities are used, and we offer therapy at 3 different locations in Cache County to be able to try to reach all of those families. Okay, I think that's that. Analee and Sarah, is there anything I missed that you think we need to make sure we say for the family place? I said it a lot, but our mission is to strengthen families and protect children. So that's a good one to keep in mind too.
Yeah, I think
Yeah, go
I
ahead.
would just add that as part of therapy, we also have a free crisis session if anyone needs crisis session. And we have an after hours crisis line as well that people can utilize at any time. So.
For sure. Thank you for reminding me of that. Okay, so we'll move into our actual topic. So the topic that we're here to talk about today is ongoing trauma. If you start to look things up, talk to people around, sometimes it can be chronic trauma. Sometimes people will call it complex trauma. It's kind of all around the same idea that it's a prolonged series of traumatic events that can have a devastating impact on a person's mental and physical health. Some of the common types of ongoing trauma that we see people experience are domestic violence, race-based traumas, natural disasters, kidnapping, and trafficking. Trafficking can include sex trafficking as well as labor trafficking, homelessness, child abuse, intergenerational trauma. And I should say child abuse would include children witnessing domestic violence, physical abuse, sexual abuse, as well as neglect. So then intergenerational trauma, war and violence, and refugee trauma. This is not an exhaustive list, so keep that in mind as we're going through. These are not every way that people experience trauma. But these are some that when we're talking about ongoing trauma or that chronic trauma, these are the ones that we see a lot of as those common types. So we wanted to kind of jump into, why does it matter for you? Why does it matter for us? Why is ongoing trauma a problem? So I tried to kind of take a world perspective first and then kind of build it down and get closer into our local statistics. So the World Health Organization has stated that 7.2% of the world's population is diagnosed with PTSD or CPTSD. So keep in mind, 7.2, that's big. Not everybody that has PTSD or CPTSD are considered ongoing trauma, and not everybody that has ongoing trauma would have those diagnoses as well. So that statistic is not perfect, but it kind of gives you a view that 7.2% of the entire world's population is dealing with side effects and disturbances in their life for PTSD or from trauma is what I meant to say. So then the next one is the World Health Survey Consortium did a survey including 68,000 people across 6 different continents that studied the prevalence of trauma based on 29 different trauma types. 70% of respondents had experienced at least one traumatic event of those 29, and 30.5 were exposed to 4 or more traumatic events, which would put them into that chronic and ongoing trauma category. So 70% of that respondents on that survey. So now moving down into Utah, DCFS's annual report from 2024 showed that there were 22,650 substantiated cases of child abuse in the state of Utah. So keep in mind, substantiated cases means that it wasn't just a call-in. There was evidence there that said, yes, this would count as a child abuse. There's a lot more phone calls and referrals that were given for DCFS to investigate. And then of those 22,000, 70% of those cases, they found that the caregiver was the perpetrator. And the reason that I thought that that was important to include is that if the caregiver is the perpetrator, there tends to be that ongoing trauma because their home should be a safe place for them to be. But because their caregiver is the perpetrator of whatever abuse is occurring, then that seems to be those ongoing cases. Okay, now we're going to bring it even closer. So this is for Cache, Rich, and Box Elder counties. We do an event at the Family Place every year, and we call it Stepping Up for Children. And we put a pair of shoes for every substantiated case of child abuse that has happened in those 3 counties, Cache, Rich, and Box Elder in Utah. And we put them on the stairs of the courthouse, and we do a little presentation. And so in 2023, there were 348 substantiated cases of child abuse in Cache, Rich, and Box Elder counties. And I wanted to make sure that we got all the way down to this local area for us to remind us that, you know, abuse is happening everywhere. Trauma is happening everywhere. The CDC has marked COVID as a traumatic event, experiencing COVID and living through COVID. And so when we're talking about trauma, we're talking about pretty much everybody. We're talking about everybody has gone through something. And so it's really important that we know how to best help those around us, especially in a professional atmosphere. So now I'm going to turn the time over to Sarah to jump into hers. And Sarah, just let me know when you're ready for me to switch slide.
Thanks, Brittany. My name's Sarah Heiner. I'm one of the clinical supervisors here at, the Family Place. I have been practicing as a therapist for about 15 years now. And I was trying to think over the multiple clients that I've worked with over the past decade and a half, and trying to think of the times when maybe trauma wasn't part of the treatment that they had come in for. And I couldn't think of one where they didn't have some kind of traumatic experience or ongoing trauma that had impacted them in one way or the other, even if they weren't coming in for that specifically. They did have typically a history or a trauma that they had gone through. And so it's very prevalent, I think, more so than we understand. So what I want to talk about a little bit is kind of set the stage for it. and what it looks like, how it impacts our friends, our relatives, our colleagues, our own clients, whoever it is that we are working with, or whoever we interact with in our regular day-to-day lives. So I want to talk about the domains of functioning that it impacts and what that looks like in each different domain. So let's start with the physiological effects, sorry. So physiological effects are of chronic and prolonged ongoing trauma is that the activation of that stress response system is pretty consistent, right? And it's just constantly activated. And because of that, that individual can experience hypervigilance or hypovigilance. We'll talk a little bit about both of those in a minute. They can experience fatigue. If you can imagine having your stress response system constantly activated, it sounds tiring to me even. So the fatigue, episodes of dissociation, we'll also touch on that for a minute. Sleep disturbance, of course, understandably, would be impacted. And then it can also impair physical health. Ongoing trauma can impact blood pressure, our heart rates, and impair our immune functioning and how well our immune system can fight for our bodies, right? Fight to keep us healthy. So let's talk a little bit about what hypervigilance is for a minute. And you may or may have not experienced or seen someone in a state of hypervigilance, but it really is this heightened awareness or a constant alertness to danger and potential threats. So this person might just not be able to relax. They might scan their environment often, react intensely to stimuli that maybe you or I think is pretty neutral or finds harmless. They might be on edge often, irritable, overwhelmed, and all of this is understandable when we know that they're going through an ongoing trauma. You can see why they might feel this way. They might overanalyze situations and look for threats or perceived threats in situations where there might not be any. One example of hypervigilance might be someone who maybe starts easily at loud sounds or sudden movements. Or someone who will sit with their back to a wall, maybe in a public place, so they can scan their environment and monitor the exits and people around them. The other opposite of that is hypervigilance. So this one is just, hypovigilance. This one's the exact opposite. We're reducing the alertness. They're not noticing or responding to important stimuli. Maybe they can't concentrate, they're forgetful, they have difficulty staying on task or paying attention. This is all when it's related to ongoing trauma, of course, because I know many of us have experienced these kind of things for ourselves at different times of our life. We're talking in relation to an ongoing trauma. This can be caused by, of course, and are symptoms of that ongoing trauma, but the fatigue that comes from it, the stress. And there may even be substance use that is happening that these symptoms can stem from as well. Dissociation. So really quick, dissociation, there's a couple different types. Mild dissociation, we all experience at one time or another, and that's just pretty common and it's harmless. It's just daydreaming and zoning out, right? All of us do that at one time or another. When we're talking about dissociation here, we're talking about severe dose dissociation that's linked to the trauma, and it can impact daily living. So this is when someone feels detached or disconnected from their body. There's memory gaps. They have difficulty recalling specific events, especially the traumatic ones. and can often feel maybe like their world isn't real or they aren't real. There's often a numbness that comes to it as well, and that they may have a problem accessing their own emotions or even being able to feel them. So what can you do if you see someone dissociating? Something that just any of us can really help with. If it's a friend, a colleague, a family member, maybe we're not a therapist, we're not sitting in a therapy office. What can we do? Just simply, excuse me, best things to do in this kind of situation is to remain calm and patient, and try and help that person maybe start breathing deeply, maybe engage them in some grounding techniques to really get those senses turned back on and engaged so that they can come back from the present. Just a couple quick little things. Other ideas too, but those are the basics that I could think of in the moment. So, okay, let's move on to the next domain of functioning where ongoing trauma can impact, and this is the psychological effects. And of course, makes sense, and we've all heard this, anxiety, depression, numbing can all be some symptoms and side effects of ongoing trauma. And we talked about numbing a little bit already. When our mind disconnects from our thoughts, our feelings, and our sense of self. So this can really lead to, and we see it a lot as therapists, feelings of detachment, apathy, lack of interest in activities, and really difficulties managing and regulating their own emotions. Suicidal thoughts are often a psychological effect as well as that possible negative worldview. Okay, Brittany, let's go to this one. Behaviorally, what is their behavior going to look like? May look like, I should say, if they're going through ongoing trauma. They might have difficulty maintaining their relationships. There may be some distrust. They may isolate in those moments. There is a higher risk of substance use and abuse. Definite avoidance behaviors, and we're talking about this loss of sense of self that we see often in our clients. It's almost a chronic and pervasive sense of shame that often happens, guilt and self-hatred. Okay, Brittany. And then the final domain of functioning I wanted to talk about today is the social, cultural, spiritual effects and how that ongoing trauma can affect that sphere of an individual's life. This one is what it sounds like, can lose interest in activities and in community engagement that maybe previously we were part of. There can be a loss in changes of an individual's system of meaning, and that can include their faith, their spirituality, or the flip side of that, if maybe there wasn't a faith or spirituality or sense of spirituality before, they may find or increase in faith or spirituality or religious beliefs. It really depends on the person. All of these symptoms are very individual to the person going through the ongoing trauma. And so it can look different for each of us. But that sense of hopelessness that it shows here at the end is really one that we see that is a common theme throughout each of these domains of functioning, is that sense of hopelessness that they carry with them. Now I'd like to talk really quick about trauma-informed care, what you can do, what resources are out there for an individual who has been through or is still going through their ongoing trauma. And then after this, just what you can do to help really briefly. outside of these kind of resources. So there's a couple of resources I want to touch on real quick. One is trauma-informed care, and the other is evidence-based modalities that are used in the trauma therapy setting. So trauma-informed care is really an approach to providing services for someone who's experienced trauma. And this it just really seeks to, again, create that environment that's safe and empowering and supportive for the individual. It has some core principles. Safety, trustworthiness, support, collaboration. We really want to empower the individual again. And then, of course, always being sensitive to their cultural, historical, or gender sensitivities or gender identities. The key components of trauma-informed care are being aware of the prevalence of the trauma, either for that individual or just in general in our communities, avoiding re-traumatization, and utilizing trauma-specific skills and training, which is what I'm going to talk about, what we do at the family place as far as trauma-specific skills and training. So there's 3 basic modalities that we use. I'm sure there's more, and these are the ones that came to the top of our minds when we were talking this through. But we utilize at the evidence base that we utilize at the family place. We utilize EMDR, CPT, and TFCBT. And just going through them really quick to identify what they are. The first one is EMDR. Its central focus really is to, that the trauma disrupts the brain's ability to process information, and it kind of leaves those painful memories stuck. And those painful memories, when stuck, can cause that emotional and physical distress. So EMDR really aims to process painful memories, reduce the emotional charge of the memories. We try to take the edge off those memories through it with EMDR, and we try to help that individual replace maybe the distressing beliefs that came from that traumatic experience. We try to help them replace them with positive and healthier beliefs about themselves. And one unique thing about EMDR is that it uses what's called bilateral stimulation to activate both hemispheres of the brain while an individual focuses on the traumatic memory. Okay, so the next is CPT. This one focuses on identifying and challenging unhelpful thoughts and beliefs that arise from the traumatic experience. Its aim is to help individuals understand how the trauma has affected them, and then reduce the distress of the traumatic memories and replace some of maybe those negative, distorted thoughts or beliefs that have come out of that traumatic experience and replace them with more healthy, adaptive ones. CPT also promotes emotional healing to help improve an individual's daily functioning. And then the last one that I want to talk about is TFCBT. This one is specifically designed to help kiddos and adolescents. And its aim really is to help children process trauma in a developmentally appropriate way. And this one definitely involves the family or caregivers in the treatment to help support kiddo in their recovery and to help improve the family functioning, because if kiddo's been through trauma, then the whole family's impacted, right? So lastly, what can we do to help? We're not in a therapy office. What can we do to help a colleague, a friend, a family member, whoever it may be, in the way that we can within our sphere? And simply be present and trustful, or build trust and listen, be patient. So these are just a few ideas. And make sure if they need help, that they find the resources within their community to get the help that they need, because there's lots of wonderful resources for individuals going through ongoing trauma. That's all for me. So I'm going to turn it over to Analee.
Thank you, Sarah. So there were just a couple of things in the chat that I just wanted to bring up. Greg had mentioned that when Brittany was talking about the different events that might create ongoing trauma, he also mentioned adding caregivers of others who have a mental or behavioral health issue. And I just want to say, like, that's so true, because on Friday I was talking to someone who hasn't had an identifiable trauma like the ones that we had listed. However, this person does have a family member, a very close family member with a mental health issue. And this person lives in constant fear of this person dying by suicide, has found them and had to call 911 many times for this family member. So not all ongoing trauma is something that maybe we can see with our eyes, and some of it is very under the surface. And so I'm curious if anyone has other ideas so that this can be brought to our awareness of who else we can maybe notice or see that aren't as easy or noticeable to see who's experienced trauma. If anyone wants to drop it in the chat or just share your ideas of maybe some other groups of people that can just help bring that to our awareness, so we can just have our eyes out for them and have that trauma-informed lens as we go out into our community and with our families and coworkers. And then the other thing that was brought up is if a person could be hyper and hypo-vigilant at the same time, maybe not necessarily at the same time, but have those two symptoms going on. And I think that, yes, I don't think there's a cookie cutter way of how an individual can experience trauma, especially when it's been ongoing and when things are layered on top of each other. There might be many triggers that create a hypovigilance response and other trauma triggers that create a hypervigilant response. And so I think they could definitely experience any array of symptoms or triggers in any sort of variety, as many as there are people on the earth. So just to answer a couple of those questions. And then before I jump into a couple of other things that I was going to talk about, I'm curious if there's any questions from the group. You can throw them in the chat or certainly unmute and ask a question if you have any before we move on. Okay. So I wanted to talk a little bit about mindfulness. This is something that I have found very helpful for many of my clients. It certainly isn't a one-size-fits-all method to helping with trauma, because sometimes mindfulness and meditation or grounding exercises can be triggering to those who've experienced trauma, depending on what their traumatic experience was and how their mind and body works with those types of things. And so just keep that in mind, that it's not for everyone, and that's okay. We can always be curious and find out what works for people around us. But the one thing that I like about using mindfulness in therapy that I do with clients, these are skills that they can use for the rest of their lives, and they have many, many benefits. They can be taught to other people. Mindfulness isn't just for mental health clinicians to use. It's something that all of us can benefit from and use and teach others about. And so when we're able to notice our own nervous systems and kind of befriend and understand them better, we give ourselves and our mind and our body just more capacity to address the issues that we're facing. And so those are a couple of reasons why I really like mindfulness and use it when appropriate with my clients. There's a really quick exercise. It's called Feet on the Floor, and I wanted to spend just 2 minutes for us to maybe feel a little bit more grounded as we've talked about ongoing trauma. It's kind of a heavy subject, and maybe we're thinking about our own experiences or those of our clients that we work with or family members, and maybe we can take this 2 minutes to put our feet on the floor and feel what even 2 minutes of mindfulness can do for us. So, okay, Brittany's got us ready. So we'll just listen.
Feet on the floor. This is also a simple practice, but feeling our feet on the floor can be a reliable anchor. Perhaps when we're feeling strong emotion, as a way of helping us to connect with a feeling of being grounded. So inviting you to bring the attention all the way down into your feet on the floor and exploring sensations in the feet. Perhaps beginning with the toes, spaces between the toes, the balls of the feet, the arches, where the soles of the feet make contact with the ground beneath you, and really sensing into these sensations of contact. Warmth, tingling, noticing how the ground beneath you is supporting the feet. Rooted, connected, steady. Weight of the body going down. Feet on the floor.
Abruptly, didn't it? It was so nice and calm, and then it's like, are we inside like a I don't even know what that was, a wind tunnel. But when you think about, at least my experience, and maybe you can reflect on your own experience as we listened to that mindfulness about feet on the floor, I hadn't noticed that my feet felt very heavy. I've been sitting in my chair all morning, and now it's afternoon, and I just noticed, like, wow, I think I'm getting cankles, and I probably need to get up and walk around after this presentation. And so even just 2 minutes of a mindfulness practice gets us maybe out of our head and just more awareness of what our body is experiencing. And like I said before, it can really give our mind and our body more capacity to just take on whatever's in front of us. Not that it changes the situation or the people that we're dealing with, or even what our past has been like, but it can give us more capacity in that moment to make the next choice or do what we need to do in the next few minutes. And so mindfulness is something that I use a lot with my clients, and it can be really helpful. One of the mindfulness skills that I bring up, probably, I don't know of a client that I haven't talked to about breathing. It's free. We all do it. We all know how to do it. And sometimes if we can have some focused breathing and maybe know how to do that just a little bit better, it can be really helpful in those times where we're triggered or remembering past trauma events or whatever it might be. It could just be stress of life or dealing with a family member that's having a hard time. When we're able to breathe, again, it gives our mind and our body more capacity to take on what's in front of us. Okay, Brittany, if you'll share our presentation again, we'll move on to the next thing. I'd like to think too that many of us probably have some really great experiences using mindfulness. Maybe there's some success stories out there, even in your own life or working with clients or just in our jobs as helpers, where mindfulness has been really impactful. And also just remembering that it's not for everyone, and that's okay too. And so maybe thinking about those times where you've used mindfulness and it was really helpful, or things went better than you had expected because of those short moments that we can ground ourselves and then jump into what's ahead. So I wanted to talk a little bit about this idea of sense of self. When I think about the clients that I've worked with who've experienced ongoing trauma, and they have layers and layers of traumatic experiences over maybe many years, it's hard for many of my clients to know who they are. And maybe you've experienced that yourself or with clients that you've worked with. Maybe you've seen that lack of who they are and not sure how we can help develop that in them. I think the first step in helping develop a sense of self is recognizing, wow, I might need some help. I can't do this myself, and reaching out to a therapist or connecting with others to help feel more supported and to be able to maybe share your experience with others. And certainly through therapy can be helpful for many who have lost that sense of self over maybe years or even decades of ongoing trauma. And that's why it gets so complex when we're in the therapy office, is because how do we peel back all those layers and figure out how to help those earlier versions of ourself feel more calm in the moment, so that our current self can feel more calm as well in our own experience. And so some of the impacts of this decreased sense of self is this difficulty of trusting their own decisions. I've seen that so many times. Clients will come in and just ask me, what should I do? I don't know what to do. And so walking through and figuring out ways to help them increase that ability to trust themselves can take a long time. We can also see that maybe they become what others want or expect them to be because they can't find that true core sense of self or their own beliefs or the way they want to identify themselves as a person. And so they become what others want them to be or say that they are. They might have difficulty advocating for themselves or establishing and keeping boundaries. Maybe not knowing their purpose in life or not knowing what they want or what they need. And those are just a few things that I've noticed in clients I've worked with. And I'm sure that there's many more impacts to this decreased sense of self that maybe you've experienced in working with others. So we've listed here just a couple of things. You can go to the next slide, Brittany. Some really simple things that maybe we can do if we find that this is something that we struggle with, or if we see someone that maybe could use some help there. If anyone has ever used the virtual Hope Box, that's an app that you can put on your phone, and it can lead you through different activities or coping skills, distraction activities as you kind of create this Hope Box on this app. It's kind of useful for a lot of different things. The VIA character strengths assessment is something that I've used with many clients, from kids to adults, in helping them learn what their character strengths are, meaning what strengths do they have that are just natural to them. And if we can find and identify some of these natural strengths, that gives a lot of hope to people who have experienced ongoing trauma and may not get that sense of hope very often. So I really like this character strengths assessment. And there's lots of uses for when we identify our strengths. And this is just a really great one. It gives you a little free printout. So I use this with clients, and it's kind of a fun strength way of addressing trauma and just finding more about themselves as they are trying to increase their sense of self. And then below, I've just attached a couple of really simple worksheets that maybe you could do with a client or even with yourself or a family member, just as a fun way of exploring who are we? Could we draw or describe different ways that we identify ourselves as? And so that's a fun worksheet. And then this other one, just listing out our strengths and our qualities. There's nothing better than switching a person's maybe negative worldview or negative view of themselves to something more positive. So anytime that I can help a client see that, yes, there are hard things that you're experiencing, and look at all of the really great and amazing things you're able to do while you're going through these hard things, and give them that little boost of hope and confidence. And so these worksheets can help create conversation as you get curious with your clients about what, who they are and what they'd like to be. Okay. The last topic that we wanted to talk about today is how working with clients who've experienced trauma, and certainly those that have experienced ongoing trauma, can be really, really hard for the helper. That's all of us. So making sure that we're aware of secondary traumatic stress, and maybe even helping our organizations become more aware of secondary traumatic stress. I think some agencies do it better than others, and I'm really grateful for the Family Place. Secondary traumatic stress is something that we talk about a lot in our meetings and with each other. And it's something that we try to address as it comes up, as well as just always educating our staff about the impacts of secondary traumatic stress so that we can keep that communication open, and not hopefully avoid the guilt and shame that might come from when we do experience secondary traumatic stress. And so symptoms look similar to those that have experienced trauma, but these are for the helpers, these are for us. And so recognizing what our how we are responding to the things that we hear and see in our line of work is really important, and understanding what we need to do to help ourselves. I think it's really important as well for not only the individual worker, but for their supervisor to really know and understand how we are impacted by secondary traumatic stress, so that we can help each other the best we can. You can go to the next slide, Brittany. As I've been at the Family Place, up until recently, we've been able to hold like a secondary traumatic stress group just for staff. And I've really ascribed to the CSERT model that's been created by Dr. Miller. And he is from Salt Lake, but this CSERT model I find really helpful, and it gives really practical tools for supervisors as well as the individual of how we can help ourselves through regular supervision, when we connect with coworkers, taking time throughout the day to address the mental and physical impact of this work has, that the impact this work has on us, and not just building it up and then thinking we're going to go do something after work is over to address this self-care. But doing it throughout the day can be really, really helpful. And then taking time to reflect on our experiences and creating a sustaining narrative about them. This is something that I really like about Brian Miller's CSERT model, is that the narrative that we form about experiences can lead us in two totally different directions. When we think after a difficult situation with a client or a coworker or whatever it might be, if our narrative is, wow, that client is so hard, I don't know if I can help them, versus a narrative when we're able to reflect about it of, wow, that was really difficult and I learned a lot in that experience. What narrative feels more sustaining? One that can give us hope and energy for the next time that we have a difficult experience with someone. And so Brian Miller said that intense experiences demand a narrative, and they truly do. And so when we're thinking about ways that we can help ourselves and our coworkers and our colleagues in this work, thinking of how we can create those narratives that can be sustaining, and creating tools and a toolbox for ourselves to help us address the impact that this ongoing trauma of our clients or family members can have on all of us. And so it certainly is not just one person's experience, but it really does have this ripple effect to the people close to them and into the community, and out from there. So that's it for me. Is there any questions? Anything to follow up with? Otherwise,
That was wonderful.
that's
Thank
it.
you. I'll leave it open for a few minutes if anybody has any questions. I haven't seen any in the chat or hands raised. But sometimes it takes us a minute to get to our mute button or type. So just appreciate your sensibility and compassion. Thanks for this space. And I really loved, I don't always love mindfulness, but I did like that feet on the floor until we had that spaceship at the end. I was abrupt. So
Yeah, I'm sorry about that.
no, it's okay. It was just like,
It
oh,
was very abrupt. Oh.
okay. Well, we appreciate it so much. I'm
I
gonna
was just gonna make a quick comment if that's
Yeah.
okay. Analee, you had asked earlier about the underlying trauma that is sometimes hard to see. And one of the things that I've just been thinking about as you've continued on with identity of self and some of the things you commented at the end, one of the things that kind of struck me is I was thinking about as we look at young kiddos and we're looking at developmental milestones and we're looking at the development of empathy, we look for that, we watch for it, we mark it as a developmental milestone. But one of the things that we don't necessarily, I think, consider is that as we age into adolescence and adulthood, empathy is still very much a component that we should and do keep. And therefore, when we, as you put in this last slide, have empathy, we then become kind of bystanders of casualties in other people's lives. And the closer we are to those traumatic events, the more likely we are to be impacted by those because of empathy. And the stronger that we have developed that empathetic factor, the more likely we are to be impacted by trauma, whether it is directly related to us by that impact personally or peripherally. And I think that that's probably part of our problem, is that the narrative around trauma is created in the sense that if it doesn't happen directly to me, I don't have a right to experience the trauma or claim it. And so therefore, one of the things that I think that we tend to do as a society is we create this idea that I don't really have a right to claim the mental health concerns that come with that. And I therefore have to figure out how to deal with that on my own. And that's probably where we are creating the misnomer, is that we look for empathy, we encourage empathy, but we don't teach how to deal with the components of that when it's not something that directly occurs to us. So if we're going to encourage and teach empathy and we look for it as a developmental milestone, we also need to teach the steps of how to we need to teach kids, as much as we teach all the other emotions and all the other things that we're supposed to deal with, how do we experience empathy appropriately and how do we deal with that appropriately, especially when trauma is involved? And how do we seek help when something traumatic occurs and we are not quite sure how to handle those empathetic reactions that we have, and that they are naturally occurring and that that's okay?
Yeah, thanks for your comment, Heather. That was really nice. And so true as well. Sometimes we get pulled into situations. One thing that I have found helpful, at least for me as a therapist, when I think about especially this CSERT model, that's really helped me come into my own as far as how I respond to secondary traumatic stress, is recognizing that when I show empathy and compassion to those that I work with, it really does fuel me to keep doing it. That's what keeps me going, and it doesn't, my compassion and empathy doesn't lead to my burnout. That's what keeps me fueled up. But I like what you're saying, and it's something to just be mindful about, as especially new people coming into the field, that all this is like, you're just kind of set into the field and like, good luck. So yeah, thanks, Heather.
Thank you. All right. Well, Heather Waters is presenting our case today. So I'm going to turn the time over to her.
Great. Can you see my screen okay? Perfect. All right. But okay. All right. So a little bit of background on this individual. So she's a 32-year-old mom, and she's been struggling with depression for the past 6 months. Her son just recently turned 3, and he's been exhibiting some challenging behaviors. Her husband works long hours, which leaves her at home all day with her son, and then frequently into the evenings alone, 3 to 4 times a week. Mom reports that her depression is impacting her ability to manage her son's behavior, and that's causing her a lot of additional stress as well as feelings of helplessness. Mom reports that oftentimes her depression is manifesting in low energy. She's lacking any motivation and is contributing to feelings of guilt. She feels overwhelmed by her daily responsibilities, and it's making it difficult for her to engage in her child or engage with her child in any positive ways. Her son's very strong-willed and highly energetic, and he's begun displaying aggressive behaviors, such as biting. His tantrums have become excessive, and he's refusing to follow instructions. He struggles with transitions, such as getting dressed or leaving the house, and he'll often have screaming fits. His mom feels guilty for not being there emotionally or emotionally available for her son. And of course, she understands that depression is contributing to his behaviors. Her son is reacting to her low energy and her emotional unavailability. And of course, he's seeking more attention through negative behaviors, and she's responding to those needs. Dad late nights at the office, and mom feeling overwhelmed and unsupported. And then, of course, the son acting out is perpetuating a very stressful home environment. So the primary areas of concern is mom's depression. She did have some postpartum depression and it resolved, but recently, again, within the past 6 months, it's resurfaced. And the depression is, it's impacting her ability to be fully present for her son, and it's impacting her ability to set and enforce consistent boundaries and to really engage in any kind of positive interaction and positive reinforcement with her son. The other area of concern would be her son's behaviors. Although some of the behaviors he exhibits would be typical for a toddler, and he just turned 3, his reactions are intense and they're prolonged. And a lot of it has to do with the emotional atmosphere at home. There's a lack of clear guidance and enforcement of consistent boundaries, and this is contributing to his defiant behaviors. Some goals would be interventions that are available to treat and support mom in addressing her depressive symptoms, and interventions, activities, and strategies to reduce her son's defiant behaviors. Some barriers include insurance and affordability. So they do have insurance. Mom is currently on medication, so they started her out at a lower dose, and now she is on 200 milligrams of sertraline. And that is the max that she's going to be taking of that particular drug. And with the insurance that they're on now, there's only certain prescriptions that are covered, and mental health counseling is capped at 10 sessions a year. And then, of course, there's a lot of social isolation going on. Mom reports that her husband's become increasingly impatient with their son's behavior. Dad will often disengage when he is home during the evenings. Oftentimes he's scolding her son because of his behavior, and then he'll blame his wife for the fact that his son misbehaves. Mom was not the sole breadwinner, but she did bring home the majority of the income. So she was a very successful attorney at a prestigious law firm in Salt Lake City, and they had a very luxurious lifestyle. Dad supported her in the decision to stay home and be a full-time mother, but they've had to alter their lifestyle significantly. They can make ends meet financially on his income, but a lot of the, vacations and a lot of the extras that they enjoyed, they've had to really scale back on, and there's a lot of resentment. Mom is feeling that Dad really is resenting her, but she still feels it's important for her to be home with her son. And of course, that is contributing to a lot of tension. And as I mentioned, she was the one that was carrying the insurance, and that coverage was a lot better. Now they have insurance through, Dad's company, and the coverage just isn't as great. And so that's been really challenging. It's trying to navigate the reduced mental health benefits instead of the support and the treatment that she needed. So this is where I could really use your support. Mom had a great circle of support when she was working. A lot of her friends were colleagues from work, and she's not in connection with them as much. She's not in contact with them as much because she worked very long hours before she had her child. This was her first and only. She didn't have a lot of friends within the neighborhood. They don't have any extended family nearby. So she's very isolated. And as I mentioned, her son has a hard time transitioning, doesn't like to leave the house. So she is very, very isolated. A lot of resentment, right? With Dad resenting Mom. So some ideas for how to really strengthen that relationship. And then, how do we work with the son's defiant behaviors? We've addressed a lot. Mom's aware of how her depression is impacting his behavior. She recognizes that the negative attention she's giving him is reinforcing his negative behavior, but they're still, again, trying to get their depression handled where there's limited supports and limited mental health resources available has been really challenging. And dad's relationship with his son is very much strained. And so focusing on how to build dad's relationship with their son, and also trying to find ways for mom to enjoy her son. She loves him, but she's really having a hard time because she's still struggling, trying to get a handle on the depression. Well, it looks like there might be questions. So from Greg, a sense of community or having your tribe is so critical for caregivers. Absolutely. Yeah. And this mom is feeling just very isolated, because she really didn't have a circle of friends outside of her colleagues at work. And she also is just, feeling somewhat embarrassed because of the inability for her to manage her son's behaviors, and that he will have prolonged screaming fits if she does try to take him outside the home. And so that's also any of their couples, friendships, they've just not been able to make